Dr. Boyle, my predecessor, Congressman Weldon, was a well-respected, competent medical doctor. But I gleaned from him some certainty that he felt thimerosal in vaccinations definitely was a contributing factor to autism. And I wonder if the CDC has conducted or facilitated a study comparing vaccinated children with unvaccinated children yet. Have you done that?
We have actually done a number of studies looking at the relationship between thimerosal vaccines and autism and other developmental disabilities.
So clearly, definitely, unequivocally, you have studied vaccinated versus unvaccinated.
We have not studied vaccinated versus unvaccinated.
Oh, that was, okay. Never mind. Just stop there. That was the meaning of my question. You wasted 2 minutes of my time. What steps has the CDC undertaken to ensure the integrity of the research that was performed by Dr. Thorson, who, as you know, has been indicted for misconduct and misallocation of resources?
Dr. Thorson, who is a co-investigator on a couple of studies that came out on autism, was really just one investigator.
Have you gone back to validate the variety of studies he participated in? I mean, you know this guy is a humongous scumbag, one of the most wanted men on earth, and you relied upon him for data to determine whether thimerosal had a negative effect?
So two studies don't conclude a body of work.
The fugitive doctor had been involved in a couple studies with CDC, and I have information here that he was involved in 21 of the 24 studies, and I would like to submit that to the record, Mr. Chairman.
Without objection, to order.
I think it's rather interesting that most of the official authorities are taking the position that the increase in autism is unrelated to the vaccine use. And one of my favorite expressions that I think is extremely true, the chronicle of man's progress is the history of authority refuted.